Lifestyle changes. Programs that help you to change your lifestyle are usually run by psychologists, nutritionists, or other professionals. The goals of lifestyle changes are to help you change your eating habits, become more active, and be more aware of how much you eat and exercise, helping you to make healthier choices. This approach to weight loss can be broken down into 4 parts: the triggers that make you want to eat, eating, setting goals, and using rewards, integrating less sedentary inactive time and more active time into your day. Triggers to eat. Determining what triggers you to eat involves figuring out what foods you eat and where and when you eat them. To figure out what triggers you to eat, keep a record for a few days of everything you eat, the places where you eat, how often you eat, and the emotions you were feeling when you eat. For some people, the trigger is related to a certain time of day or night. For others, the trigger is related to a certain place or activity, like sitting at a desk working or driving past a favorite fast food outlet. You can change your eating habits by breaking the chain of events between the trigger for eating and the act of eating. There are many ways to do this. For instance, you can use a smaller plate for meals, make a conscious effort to eat more slowly, add more colorful non-white foods to your meals, keep healthy snacks like chopped raw vegetables, fruits, and nuts around in case you get hungry between meals. The types of foods we eat on a regular basis are related to whether we gain or lose weight over time. Whole grains, fruits, vegetables, nuts, and yogurt are associated with maintaining a lower weight, while foods like French fries or chips, sugar-sweetened beverages, and red or processed meats are associated with weight gain. High fructose-containing beverages, trans fats, and highly processed foods are particularly harmful for health and maintaining a healthy weight. Setting goals and using rewards. Rewarding yourself for good eating behaviors can help you to develop better habits. The idea is not to reward weight loss, but to reward yourself for changing unhealthy behaviors to healthy ones. Do not use food as a reward. Some people find monetary rewards buying a new piece of clothing, personal care a haircut, manicure, or massage, or leisure activities watching a favorite TV show or playing a game to work well. Giving yourself small rewards each time you make better eating choices helps reinforce the value of the good behavior. It's important to set clear behavior goals as well as a time frame for reaching your goals. For example, you might set a goal to avoid snacking after a certain time every day for a week, with a longer-term goal to lose 5% of your weight by a certain date and 10 or 15% by a later date. Reward small changes along the way to your final goal. Factors that contribute to successful weight loss. Changing your behavior involves more than just changing unhealthy eating habits. It also involves finding people around you to support your weight loss, reducing stress, and learning to resist temptations. Establish a buddy system. Having a friend or family member available to provide support and reinforce good behavior is very helpful. Learn to avoid temptations when possible. Avoid situations in which your ability to stick to healthy eating may be threatened. Not all situations are avoidable. So in addition, learning to be strong when tempted by food is an important part of your weight loss plan. As an example, you will need to learn how to say no and continue to say no when urged to eat at parties and social gatherings. Develop strategies for events before you go, such as eating before you go or taking low-calorie snacks and calorie-free drinks with you. Develop a support system. Having a support system is helpful when losing weight. This is why many commercial groups programs for which you pay to be a member are successful. Family support is also essential if your family or partner does not support your efforts to lose weight. This can slow your progress or even keep you from losing weight. Positive thinking. People often have conversations with themselves in their head. These conversations can be positive or negative. If you eat a piece of cake that was not planned, you may respond by thinking, well, it's all over now. You've blown your diet, and as a result, you may eat more cake. A positive thought for the same event could be, well, I ate cake when it was not on my plan. Now I should do something to get back on track. A positive approach is much more likely to be successful than a negative one. Reduce stress. Although stress is a part of everyday life, it can trigger unhealthy eating habits in some people. It is important to find a way to get through these difficult times without eating, or by choosing low-calorie food instead, like raw vegetables. It may be helpful to imagine a relaxing place that allows you to temporarily escape from stress. With deep breaths and closed eyes, you can imagine this relaxing place for a few minutes. Weight loss programs. Organized programs like Weight Watchers, Overeaters Anonymous, and Take Off Pounds Sensibly work for some people. As with all weight loss programs, you are most likely to be successful with these plans if you make long-term changes in how you eat, exercise, and movement. While exercise alone is not likely to result in weight loss, getting regular physical activity has many other health benefits. In addition to improving physical health, it also lowers stress. You don't need to do intense exercise or go to the gym daily to get these benefits. Even small changes, like taking the stairs instead of the elevator and making sure to get up frequently if you work at a desk, can improve your health. Your eating habits. A calorie is a unit of energy found in food. Your body needs calories to function. If you are trying to lose weight, the goal of any eating plan is to burn up more calories than you eat. How quickly you lose weight on a given calorie intake depends upon several factors, such as your age, sex, and starting weight. In general, older people have a slower metabolism than young people, so it takes longer for them to lose weight. Males lose more weight than females of similar height and weight when dieting. This is because they have more muscle mass, which uses more energy. People who are extremely overweight lose weight more quickly than those who are only mildly overweight. How many calories do I need? The number of calories you need per day depends on your current or target weight, sex, and activity level. Your healthcare provider can help you figure out this number and how to modify your diet accordingly. In general, it is best to choose foods that contain enough protein, carbohydrates, essential fatty acids, and vitamins. Try to avoid or at least limit alcohol, sugar-sweetened beverages, sodas, and fruit drinks, and sweets, candy, cakes, cookies, since they have calories but generally lack important nutrients. Portion-controlled diets. A simple way to diet is to buy prepackaged foods like frozen low-calorie meals or meal replacement canned drinks or bars. A typical meal plan for one day may include a meal replacement drink or breakfast bar for breakfast, a meal replacement drink or a frozen low-calorie 250 to 350 calories meal for lunch, a frozen low-calorie meal or other prepackaged, calorie-controlled meal, along with extra vegetables for dinner. Low-fat diet. Reduce the amount of fat in your diet. You can eat low-fat foods. You can look at the nutrition label to see how much fat is each serving of a food. Count fat grams for a 1500 calorie diet. This would mean approximately 45 grams or fewer of fat per day. If you try a low-fat diet, you should increase the amount of healthy carbohydrates in your diet: egg, whole grains, fruits, and vegetables. Low-carbohydrate diet. Low and very low-carbohydrate diets. Egg, Atkins diet, South Beach diet, or ketogenic diet are effective for weight loss and have become popular ways to lose weight quickly. With a low-carbohydrate diet, you eat between 60 and 130 grams of carbohydrates per day. With a very low-carbohydrate diet, you eat between 0 and 60 grams of carbohydrates per day. A standard diet contains 200 to 300 grams of carbohydrates. Carbohydrates are found in fruits, vegetables, grains including breads, rice, pasta, and cereal, alcoholic beverages, and dairy products. Meat and fish contain very few carbohydrates. If you try a low-carbohydrate diet, it's important to make healthy choices for fat and protein: egg, fish, nuts, beans. Eating a lot of saturated fats found in butter and red meat can increase your cholesterol level and raise your risk of heart disease. Mediterranean diet. Term Mediterranean diet refers to a way of eating that is common in olive-growing regions around the Mediterranean Sea. Although there is some variation in Mediterranean diets, there are some similarities. Most Mediterranean diets include a high level of monounsaturated fats from olive or canola oil, walnuts, pecans, almonds, and a low level of saturated fats from butter. A high amount of vegetables, fruits, legumes, and grains. 7 to 10 servings of fruits and vegetables per day. A moderate amount of milk and dairy products, mostly in the form of cheese. Use low-fat dairy products: skim milk, fat-free yogurt, low-fat cheese, a relatively low amount of red meat and meat products. Substitute fish or poultry for red meat. For those who drink alcohol, a modest amount, mainly as red wine, may help to protect against cardiovascular disease. A modest amount is up to 1 4-ounce glass per day for females, and up to 2 glasses per day for males. Which diet is best? Studies comparing different types of diets have not found a single best weight loss diet for all people. However, any diet will help you to lose weight if you are able to stick with it. Following a very restrictive diet may help you lose weight quickly, but it's easy to gain the weight back as soon as you stop following the diet. Therefore, it is important to choose an eating plan that includes foods you like. Fad diets often promise quick weight loss, more than 1 to 2 pounds per week, and may claim that you do not need to exercise or give up your favorite foods. Some fad diets cost a lot of money because you have to pay for seminars, pills, or packaged foods. Fad diets generally lack any scientific evidence that they are safe and effective, instead relying on before and after photos or testimonials. Diets that sound too good to be true usually are. These plans are a waste of time and money and are not recommended. A healthcare provider can help you find a safe and effective way to lose weight and keep it off. Medicines. Medication may be helpful for weight loss when used in combination with diet, exercise, and lifestyle changes. However, it is important to understand the risks, benefits, and limitations of these medicines. They can cause side effects that may be bothersome, and in many cases the long-term safety data are limited. In addition, these medicines may not be covered by insurance and can be expensive. Although weight loss medicines may not help you reach your dream weight, they can contribute to reducing your risk of diabetes or heart disease. Weight loss medicines may be recommended for people who have not been able to lose weight with diet. Incretin-based therapies. These include dual-acting glucagon-like peptide-1 GLP-1 and glucose-dependent insulinotropic polypeptide GIP receptor agonists. GLP-1 receptor agonists. GLP-1 and GIP are both hormones called incretins for this reason. These medications are also known as incretin-based therapies. They work by increasing insulin release in response to a meal when blood sugar is high, slowing digestion and making people feel full more quickly. Incretin-based therapies were initially approved for the treatment of type 2 diabetes, but some of these medications can also help with weight loss. Only some of the medications in these categories are approved for treating weight loss in people without diabetes. They are given by injection under the skin in the abdomen, thigh, or upper arm. These medications can cause gastrointestinal side effects such as nausea, vomiting, diarrhea, and constipation. These medications should not be taken during pregnancy or if you have a history of pancreatitis, or a personal or family history of medullary thyroid cancer, or a disorder called multiple endocrine neoplasia. If you have diabetes and take other medications to help control your blood sugar, your provider will want to monitor your blood sugar closely and may reduce the dose of your other diabetes medications while you are taking these medications. Tirzepatide brand name Zepbound is a dual-acting GLP-1 and GIP receptor agonist. It is injected once a week. Tirzepatide may be the most effective medication for helping people lose weight. In studies, most people taking tirzepatide lost at least 5% of their body weight, and the average weight loss was 21%. Semaglutide and liraglutide are GLP-1 receptor agonists. Studies suggest that they have cardiovascular benefits in people with diabetes. Semaglutide has also been found to have cardiovascular benefits in people without diabetes. Liraglutide brand name Saxenda is injected once daily, while semaglutide brand name Wegovy is injected once weekly. The doses of these medications that are most effective for weight loss are higher than those used to treat diabetes. Other medications in general. The incretin-based therapies are usually recommended first for people who are candidates for weight loss medication. However, other options are available for people who cannot or choose not to take these medications. Phentermine topiramate and extended release topiramate are available in combination as a single capsule brand name Symia. Topiramate is used for the prevention of migraine headaches and to treat seizures in people with epilepsy. People taking topiramate for these indications lose weight, but the way this works is uncertain. People taking this combination medication lose approximately 8 to 10% of their initial body weight after 1 year. The dose of phentermine topiramate is usually increased gradually, while weight loss is monitored. If you do not lose 5% of your initial body weight after 12 weeks on the highest dose, phentermine topiramate should be discontinued gradually, as abrupt withdrawal of topiramate can cause seizures. The most common side events are dry mouth, constipation, and a pins and needles sensation of the skin. There is also a risk of psychiatric and cognitive problems. This risk increases with larger doses of the medication. Although phentermine topiramate improves blood pressure slightly, it is also associated with an increase in heart rate. Phentermine topiramate should not be used during pregnancy because of the risk of birth defects. People who could get pregnant should take a pregnancy test before starting this medication and monthly thereafter to ensure that they are not pregnant. It should also not be used in people with cardiovascular disease, high blood pressure, or coronary heart disease. Naltrexone bupropion is a medicine that is used to treat depression and to prevent weight gain in people who are trying to quit smoking. Naltrexone is a drug used to treat alcohol and drug dependence. People taking combination naltrexone bupropion brand name Contrave lost approximately 5 to 6% of their initial body weight after 1 year. Common side effects include nausea, headache, constipation, insomnia, vomiting, dizziness, and dry mouth. The dose of naltrexone bupropion is increased gradually over 4 weeks. If you do not lose at least 5% of your initial body weight after 12 weeks, the medication should be discontinued because benefit is unlikely. Naltrexone bupropion should not be used in people with uncontrolled high blood pressure, a seizure disorder, or an eating disorder. It should also not be used by people who take or have recently taken certain other medications, including those containing bupropion, chronic opioids, or monoamine oxidase inhibitors. Orlistat listed brand name Xenical is a medicine that reduces the amount of fat your body absorbs from the foods you eat. A lower dose version, brand name Ali, is available without a prescription in many countries, including the United States. The recommended dose of the prescription version is 1 capsule 3 times per day taken with a meal. You can skip a dose if you skip a meal or if the meal contains no fat. After 1 year of treatment with Orlistat combined with lifestyle changes, the average weight loss is approximately 8 to 10% of initial body weight. Cholesterol levels often improve and blood pressure sometimes falls. In people with diabetes, Orlistat may help control blood sugar levels. Side effects may include stomach cramps, gas, diarrhea, leakage of stool, or oily stools. These problems are more likely when you take Orlistat with a high-fat meal. If more than 30% of calories in the meal are from fat, side effects usually improve as you learn to avoid high-fat foods. Severe liver injury has been reported rarely in people taking Orlistat, but it is not known if Orlistat caused the liver problems. Phentermine is a medicine that reduces food intake by causing you to feel full more quickly after eating. Phentermine is classified as a controlled substance by the United States Food and Drug Administration due to its potential for abuse. Although the actual observed rate of abuse is extremely low, it is the most widely prescribed single-agent weight loss drug in the US. In trials ranging from 12 to 36 weeks, patients taking phentermine lost an average of approximately 15 to 17 pounds, 7 to 8 kilograms. Phentermine may cause an increase in blood pressure and heart rate. Your healthcare provider will monitor you for these side effects while you are taking the medication. In addition, phentermine may cause insomnia, dry mouth, constipation, and nervousness. You should not take phentermine if you have heart disease, uncontrolled high blood pressure, hyperthyroidism, or a history of drug abuse. Supplements not recommended. Dietary supplements are widely used by people who are trying to lose weight. However, doctors do not recommend their use because some are unsafe, and other supplements have not been studied carefully and there is no proof that they are safe or effective. You may have heard of some of the following dietary supplements, which are often advertised for weight loss. None of these are recommended. Ephedra, a compound related to ephedrine, is no longer available in the United States due to safety concerns. Many non-prescription diet pills previously contained ephedra. Although some studies have shown that ephedra helps with weight loss, there can be serious side effects, psychiatric symptoms, palpitations, and stomach upset, including death. 2 supplements from Brazil, Emagri Sim, also known as the Brazilian diet pill, and Herbithin dietary supplement, have been shown to contain prescription drugs and should be avoided. Bitter orange, Citrus aurantium, can increase your heart rate and blood pressure. and is not recommended. There are not enough data about safety and efficacy to recommend chitosan, chromium, green tea, Hoodia gordoni, hydroxycitric acid, or conjugated linoleic acid. Human chorionic gonadotropin (HCG) is a hormonal preparation, usually given by injection, that has been advertised as a weight loss aid. When combined with a very low-calorie diet, there have been several studies showing that HCG is no more effective than placebo, thus, it is not recommended.